Good evening, everyone, and welcome. My name is Dr. Kim Hecht, and I am the medical director here at the Susan Samueli Integrative Health Institute for the inpatient and ambulatory care services. Thank you so much for joining us during our free community lecture, Integrative Insider Live, where we share insights on integrative whole person health. This event is free to the public. All registrants will receive a follow-up email with a link to the recorded session. Our main clinic is on the UCI campus, which is designed to empower you on your whole health person journey. We also offer integrative services at other UCI health sites, including Newport Beach near Fashion Island, Pacific Breast, and Oncology Hematology at Pacific Medical Plaza in Costa Mesa, as well as clinics in Yorba Linda and Laguna Hills. So before we get started, there are a few Zoom housekeeping items to mention. Number one, we are recording this session. All registrants will receive an email with a link to the recording. I had said that before. Number two, to minimize distractions, everyone will remain mute with their video off. Please utilize the Q&A feature at the bottom of your screen for any questions or to communicate with us during the session. And then number three, after the presentation, I will moderate a Q&A session. So on to the main event. For tonight's session, we have Dr. Ryan Herring, who will talk to us about how lifestyle medicine provides a personalized, evidence-based approach to achieving and maintaining healthy weight by addressing the root causes of weight gain and focusing on sustainable behavioral change. This patient-centered model empowers long-term success and overall health transformation. Dr. Ryan Herring is dual board certified in preventative medicine and lifestyle medicine. He also is one of our concierge physicians at our institute. He provides comprehensive care with expertise in evidence-based lifestyle medicine interventions that treat root causes of disease. He utilizes an integrative medicine approach to help patients develop a personalized toolbox of therapies to optimize their health and well-being. Additional areas of interest include obesity medicine, group medical visits, and culinary medicine. Dr. Herring earned his medical degree from the University of Illinois College of Medicine and completed residency in preventive medicine at Loma Linda University Health. His residency provided an educational pathway to additional board certification in lifestyle medicine. So please join me in welcoming Dr. Ryan Herring to Integrative Insider Live.
Thank you, Dr. Heck, for that introduction, and good evening, everyone, and thanks for everyone who has joined tonight. I'm very excited to present this information to you, and I am very much looking forward to you being able to take this information and apply it to your own lives. So we're going to be looking at the lifestyle and integrative health approaches to optimizing body composition with aging, and we really have three main objectives tonight. We're going to look at the aging human body and the accompanying body composition changes that happen. We're going to look at lifestyle medicine strategies to optimize those body composition changes, and then a few evidence-based supplements that I feel can also support you in achieving an ideal body composition. So starting first, looking at the aging human body. So I want to look visually here first at the most common changes in body composition with aging. And what we're looking at here are whole body DEXA scans. So you can see a lot of interesting things lighting up here. And when I say body composition, we're really breaking this down into two main buckets. So we have our fat mass, which is depicted by the yellow coloring here in these pictures. And then the fat-free mass is basically everything else in the body that makes up our weight. And that includes lean muscle, all of our organs and soft tissue, bone, and of course, water content. So in these particular scans here, the brighter the color that you see, that indicates denser or stronger areas as compared to less brightness in the color. So for example, when we look at this blue turquoise, that is looking at the actual bone density. So we can see that in young males and females, there's a lot of very strong bone density. But as you get older, we're losing bone density naturally. And what we see is some of those areas turning from this turquoise blue to a darker blue, and that indicates a loss of bone density. So there's a general trend here as we get older that most of us are gaining fat, and at the same time, we're losing some degree of lean muscle, as well as other lean tissue, and along with that bone density. So it's very interesting to compare these between young and old, and at Susan Samueli Integrative Health Institute, we're able to do this through a body composition analysis through the in-body. There's also the SIHI scan, but we're able to get some similar information here. Being able to actually quantify just through this non-invasive tool by stepping on the scale and actually quantify your fat mass, your body fat percentage, as well as the lean mass and the water content. And what's really cool is we can break this down by limb actually and look at the lean mass in all of your limbs and your trunk and your abdomen. We're also able to estimate the amount of visceral or the deeper fat around the organs. And what's not shown here is an estimation of your total energy expenditure, the amount of calories you're burning just through living and carrying out your daily lives and through physical activity. And we're going to talk about that some more. But I find that this is a very helpful tool to track over time, not just with age, but through different periods of weight changes, whether weight's going down or going up, as well as different medical conditions that may cause muscle wasting, for example, as well as just getting a general sense of how you're doing in your lifestyle areas with your nutrition, your activity, your sleep, and stress management. So let's take a closer look at some of these natural changes in body composition across the lifespan. And the reality is that many individuals are experiencing significant body composition changes earlier in life due to rising rates of obesity and overweight and having multiple chronic medical conditions as well as sedentary lifestyles. So similar to that first slide, when we're looking at the different colors here, a lighter color intensity indicates lower values or lower strength. And so as we track each of these areas with bone mass, there's a general trend of loss of bone mass, and there's a few key time points as well that vary between males and females. And one of those in particular is with menopause in women. Actually, in the first 5 to 7 years after menopause, you can lose up to 20% of your bone mass. So for both males and females, there's this overall trend of loss of bone mass as well as muscle mass. And for some, the muscle mass is significant enough to cause something called sarcopenia, which has to do more with not just muscle mass, but loss of the function and strength of that muscle mass. So together, those two, can increase risk of frailty, and there's a frailty syndrome that can really affect your quality of life. At the same time here, there's again that increase in overall fat mass as you get older. Men do have more muscle mass than women across the lifespan, and so they probably proportionally lose more muscle mass with aging. However, women actually lose strength sooner than men. But what's really interesting, and we're going to talk about resistance training, is that when we're comparing men and women, they can gain really about the same amount of muscle proportional to their starting muscle mass. Now, one thing that's happening also in the background with aging is this low-grade chronic inflammation, and this is just one mechanism that really links all these body composition changes together. And in fact, there are really multiple very complex mechanisms happening in the body that are driving these changes, and they're happening simultaneously. So for some individuals, though, we do see a more dramatic increase in fat, which we're calling adiposity, alongside the loss of muscle mass, sarcopenia, and the bone loss, which can progress to osteopenia or osteoporosis. So these individuals can lose muscle, bone, or both disproportionately to their body size. So this is why it's just so important to assess body composition in the context of weight rather than just looking purely at body mass index. So this term, osteosarcopenic obesity, is describing these three conditions together. And it doesn't necessarily mean you have to have a body mass index that is classified as obesity, a BMI of 30 or higher. But it really looks more at the body composition changes. So some individuals have so much excess fat mass and their body fat percentage is so high that they could be considered to have obesity, even though their weight may not reflect that. Um, so there are really a few key drivers here of excess fat gain, and at the root and the foundation of this is an imbalance between energy intake through calories and then energy expenditure, the amount of calories you're actually burning. There's also adipose tissue dysfunction, and what I mean by that is that the cells within your fat mass become dysfunctional as you age, and that can start to shift the fat distribution to different parts of the body, including around the organs, but also infiltrating our muscle and our bone. And that has some really significant complications from that. We also see less total energy expenditure with aging through a natural decrease in physical activity, through resting energy expenditure, as well as a decrease in the thermic effect of food, which we'll talk more about. We're all probably familiar with some of the hormonal changes of aging, and this varies between males and females, but there is a decline in estrogen and really a loss of estrogen once you go through menopause for women. And there's other hormonal changes that may come at different stages there. And in men, the dominant change there is with testosterone. With the increase in fat mass, we also see more insulin resistance, which further drives an increase in fat mass and potentially a loss of more muscle. There's also a decrease in other hormones here that help with muscle preservation and bone as well, including growth hormone and insulin like growth factor 1. So collectively, these changes increase risk of falls and frailty, as well as overall morbidity through an increase in cardiovascular disease, diabetes, cancer, and disability, as well as the emotional toll of depression and more social isolation. So, one surprising finding from a recent study, it was over 6,000 individuals from around the world. They were looking at, well, what's happening with the weight changes as you age, right? And I think a lot of people assume that there is this slowing in the metabolism. And the question is, when is that actually happening? And when does that become significant for the body composition changes? So it turns out that our metabolism really doesn't naturally slow until later in life, after age 60. Not surprisingly from this study, we see that the higher amount of fat-free mass you have, the higher your total energy expenditure, the amount of calories you burn just through living. Um, but when they study these individuals and they were able to adjust for fat-free mass, so let's say they assume that everyone had about the same amount of fat-free mass, they found that throughout adulthood, from about the age of 20 to 60, our metabolism is overall pretty stable, even through pregnancy, surprisingly. So there are other things that are happening here. It's not till after age 63 or so that there is a gradual decline in our resting metabolic rate, the metabolism, as well as the total energy expenditure. Now, the reality is, though, that because of increasing obesity and overweight and all the chronic medical conditions, people really are experiencing changes at different times in their life in terms of their resting metabolic rate or the amount of energy they're able to expend. So I just want to point out, though, that if you're experiencing weight gain in midlife, you really can't fully blame it on a slowing of your metabolism. So there must be something else going on here. This is where total energy expenditure becomes really important, right? And there are three main buckets here that contribute to energy expenditure. And what I mean by that is the calories that we're burning. So our resting metabolic rate are just the calories to sort of keep the lights on, right? I mean, the basic physiological functions, maintaining all of your tissue, that's the biggest percentage of the energy expenditure bucket. After that is activity related energy expenditure, and that can be through structured physical activity or just through daily living and carrying out things like, standing, talking, climbing stairs and whatnot. The third part here is the thermic effect of food. These are the amount of calories you burn through ingesting and absorbing and digesting food. So it's only about 10% of your calorie expenditure. This adaptive thermogenesis becomes really important if you're working on weight loss. And this is a regulatory system the body has that fights against body weight changes. And this has a very historic root, in terms of survival, a survival mechanism, during times of famine and starvation, there are changes that happen in the body to prevent excess weight loss and to try to preserve and hold on to tissue. Now, in our current environments where we have more obesogenic environments that are promoting weight gain, the body has tried to figure out how to deal with that. And so this adaptive thermogenesis really is altering both our resting and our non-resting energy expenditure. But what's really surprising and what can be so frustrating about weight loss is that the changes in overall energy expenditure often exceed what you would expect for a given amount of weight loss. So, for example, let's say someone loses 10% of their body weight and they're able to maintain that. Often it's accompanied by an even greater reduction in total energy expenditure, maybe 20 to 25%, right? So the initial calorie deficit that someone used to get to a lower weight now is increasing and expanding in terms of how many calories you're taking in versus expending in order to maintain that weight loss or to push even further to lose more weight. So this can at least partially explain why weight loss can plateau at times, and that can be very frustrating. So how do you get past that? Depending on what your calorie deficit is in terms of calories coming in, you may already be at a pretty low point to get that initial weight off, and further pushing your calories down may not be an ideal situation. It may just be too low and you're not going to feel well. So there are other ways to try to overcome that. And research is looking at how to do that aside from all the current medical therapies and surgical therapies that we have now. Uh, the energy expenditure through activity becomes even more important now. And particularly this non-exercise activity thermogenesis, called NEAT, turns out burns more calories per day than even structured exercise. So on the left there in that figure, you can see, again, those three buckets that make up total energy expenditure. Most of that is the basal metabolic rate. Behind that is physical activity. And the third part is the thermic effect of food. If we compare the neat part of that, the amount of calories that are expended just through, let's say, working, leisure time activities, sitting, standing, climbing stairs, even things like fidgeting, toe tapping, believe it or not, burn calories. Turns out that a sedentary individual, their NEAT can be overall pretty low, maybe only 6 to 10% of their energy expenditure compared to someone who's very active. That can go all the way up to maybe 50%, right? So this becomes a tool we can leverage as far as getting more weight off or at least maintaining the weight loss and trying to prevent that weight regain. On the right there, the NEAT you can see varies significantly by your occupation. So if you're working a mostly seated job or some kind of desk job, you're not burning as much calories compared to someone who has a very active job working in agriculture or farming. Those people may be burning 2, 3 times more calories in the daytime. just through their occupation. NEAT can vary highly between individuals and even among two adults of the same age, same body size, in lean mass. So, um, if we look a little bit deeper here, as far as other things that are affecting energy expenditure, one of the other things that happens, which can probably explain a lot of this slowing of the metabolic rate later in life, is that, with the body composition changes, the skeletal muscle in particular, is you're starting to lose enough skeletal muscle that it actually lowers your resting metabolic rate. Another thing I want to point out here is that when we look at your overall body mass, let's say for this individual, they have a body fat percentage of 21%. That adipose tissue, the fat mass, contributes very little to their resting metabolic rate, right? So even though it's making up maybe a fifth or more of their body weight, it's not expending a lot of energy. It's really more the muscle and all these other organs that are very active. As you get older, there is a decrease in the overall mass of some of these organs, and that's an area of research as well, looking at how that may contribute to a lowering of the metabolic rate. If we look at the trend of overall muscle and strength loss, the loss of muscle mass happens much earlier than you might think. Even as early as your 30s and 40s, you start losing maybe 1% of your muscle mass every year, about 8 to 10% per decade. So by the time you're in your 70s and 80s, you might have half or less of the amount of muscle mass you had when you were much younger. You lose strength at an even more accelerated rate, maybe 2 to 3% loss of strength, right? So even though you may have a certain amount of muscle mass, yeah, you could be losing strength, and this is where it starts to affect your quality of life. I think what is really contributing to this is that, most of us are not having a nice, smooth loss of muscle mass. So in the top here of this figure, you can see a hypothetical example here of this trajectory of muscle loss of just normal aging. The reality is most of us are going to go through periods where we have disuse of our muscle. We're really not using it very much. And this can be during times of illness where you're at home and in bed, not moving much, or even hospitalized, having surgery, or just a general reduction in the amount of daily steps. So each time that happens here, indicated by these red arrows, we see a stepwise drop in the overall amount of muscle mass. And as you get older, there is incomplete recovery of that muscle mass. So you just lose that ability to get back to the same amount of muscle mass that you had compared to someone who's younger. And if they have one of these disuse events, they can get complete recovery. And even beyond that, if they continue resistance training. Alongside all this, we have these chronic muscle wasting conditions, different forms of autoimmune disease, diabetes, certain lung diseases that can accelerate this even further. So we have to think about from a lifestyle medicine standpoint, what can we do to really fight against this? And it turns out there's a lot we can do. And the most important thing is to keep moving. And as I was talking about earlier with the NEAT, this activities of daily living, there are many ways that you can avoid a sedentary lifestyle. So the average American may sit, 7 hours a day or more, and this has significant implications for their health. There are many things you can do to fight against this and break up your day. Standing desks have become very popular. If you're at a mostly seated desk, just getting up often, taking breaks with squats, for example, taking a short walk. There's many ways to do this. Now, if we look at structured exercise, resistance training and aerobic training actually overlap quite a bit in terms of how they support our health, specifically with body composition, uh, glucose or blood sugar regulation, mobility, cognitive function, and mitochondrial function. But where resistance training really um, is setting out here is with preventing a decline in muscle mass, as well as that strength loss that's happening at a more accelerated rate. Let's look a little bit more at exercise for body composition. So whether we're talking about weight loss, weight maintenance, or a gain in lean mass or fat loss, generally having a combination of aerobic and resistance training provides the most benefits. But when we look at weight loss and fat loss specifically, aerobic training may stand out a little bit more compared to weight combined training, as well as lean mass gain. We know is really the best way to do that. And doing a combination of training if you can, but really any training, any form of exercise is better than no exercise. So doing what you can at your stage of life is always the best approach here. If we look at exercise intensity for bone density, the reality is that any intensity, whether it's low, moderate, or high intensity, does support bone density. But where most of the research lies is with moderate intensity. And for resistance training, that would be approximately 65 to 80% of your one rep max. And there are ways to calculate how much weight you should use for your theoretical one rep max. There are tools online you can use to calculate that. But generally, we're working in the 8 to 15 rep range, which I think is a pretty comfortable range for most people. We also know that impact exercises provide that stimulation to the bone for bone remodeling. And with moderate intensity, getting up to 2 to 4 times your body weight through doing things like heel drops, jump roping, skipping, different forms of aerobics, and finding ways to modify that for your activity level. But we also know that walking, just doing brisk walking, although that's a lower intensity exercise, does help with bone density. So there's a variety of different exercises here that you can choose from and tailor that to your individual preferences. Resistance training becomes, I think, probably the most important thing during weight loss in terms of trying to prevent excess fat-free mass loss. So as you lose weight, it's really unavoidable that you're going to lose some degree of this fat-free mass. And anywhere from maybe 20 to 40% of every pound you lose can be fat-free mass with an average of maybe 25%. And this is going to vary by your age and sex and how fast you're losing weight, as well as the intensity of the intervention. We know that individuals who have obesity or excess weight often do have more muscle mass than lean individuals, but that muscle is of poorer quality, and therefore they have more physical function limitations. So the goal is to try to preserve the muscle, but also improve the overall quality of the muscle through a dedicated strength training program. The bottom line is that resistance training is really the optimal way to preserve muscle and build strength during weight loss. And by doing this, you're supporting that resting energy expenditure through preserving the muscle mass, and this helps a lot with maintaining the weight loss. I like resistance training so much because, well, I think it's for almost everyone. There are a few reasons why you might not want to do it. But across all ages, almost all chronic conditions, even during pregnancy, and there are many ways to perform this, whether it's body weight exercises, using resistance bands, different machines, or free weights. You really want to tailor it to your starting point, as well as your overall mobility, and working with a personal trainer can be very helpful to dial that in for you. This is an example of resistance training prescription. So again, for most people, for the general population, working in that moderate intensity category, um, across the columns here, you see a percent of one rep max. I mean, that's really just the amount of weight you're using. We can also look at the number of reps you're doing per set, or how many times you're working out per week. In order to progress time, you're really modifying one or more of these categories here. In the bottom there are a few contraindications to at least starting resistance training, and these would be things like unstable heart disease or heart failure, very high uncontrolled blood pressure, certain conditions, genetic conditions like Marfan syndrome. And one thing that gets overlooked is if you have a certain eye disease, like a type of retinopathy, you may want to undergo a clearance prior to starting that. Other conditions like diabetes um, or history of stroke, these are not contraindications, obviously, to start. And in fact, I would want my patients who have these types of chronic conditions to be doing this. But it's best to work with your provider because sometimes we have to modify medications, in particular with diabetes medications, to prevent low blood sugar. Because doing more moderate to high intensity exercise can pretty quickly drop blood sugar, actually. So keep that in mind. Now, a simpler way to think about the intensity of exercise is to think about your overall effort. So this rate of perceived exertion, RPE, is a very helpful scale that you can use. And this is based on the number of reps in reserve, or the number of reps you might leave in the tank, so to speak, when you are finishing a set. It turns out that muscle can grow across a wide range of reps. So it doesn't matter necessarily whether you're using a heavier weight for 5 reps or a much lighter weight for higher reps, 20, 25 reps. You can see comparable muscle gain, assuming that you're taking your sets close to failure. So taking it close to failure might be working in this RPE of 8 all the way up to 10. So let's say you do a set of like a lat pull down on a machine. If you finish that set, let's say you do 10 reps, um, ask yourself, how many reps could you have done more realistically, right? And I encourage you to challenge yourself to see how far you can take that, and doing that safely, of course, and trying to prevent injury. But the research really does show that if you can work closer to failure, it drives more muscle growth and allows you to maintain that muscle. I think what all of us desire is to really maintain our cognitive function and to be physically independent as we get older. And the research really does show that doing resistance training across the lifespan provides that benefit compared to individuals that may be just more recreationally active. They may experience higher rates of mild cognitive impairment or some mobility limitations. And if you're living a very sedentary lifestyle, as you get into your older years, this is where we start to see cognitive impairment maybe setting in sooner, and you become physically dependent on others to carry out your activities of daily living. Older adults who strength train twice a week have almost a 50% lower odds of dying from any cause than those who do not. And in terms of lifestyle interventions, there are very few lifestyle interventions that can achieve that kind of health outcome. Let's shift to talking about optimizing nutrition for body composition. And I really recommend not just eating for body composition, but really eating for optimal health. You can do both. So if there's weight to lose, you really have to modify your energy intake to get into a calorie deficit. So lowering your calories more than the amount of calories you're expending through that total energy expenditure. And there's really 3 main ways to do that. There's a general calorie restriction. There's macronutrient restriction, such as eating low fat, or for some people, they prefer eating low carbohydrate. There's also feeding time restriction, so doing intermittent fasting. The reality is that all of these are working to just get you into a calorie deficit. So I recommend finding a path that feels like it has the least resistance. And the ideal approach should be individualized, sustainable, and health focused. When we look at the bulk of evidence for nutrition for optimal health, there are some themes that emerge across evidence-based dietary patterns. And those include eating a mostly whole food, minimally processed, high fiber diet. So fiber is only found in whole plant foods. So we really want to emphasize vegetables, fruits, whole grains, legumes, nuts, and seeds. I recommend a moderately high protein intake on the order of 1.2 to 1.5 grams per kilogram of your ideal body weight, which is, significantly higher than the RDA, the recommended daily allowance for protein of about zero point 0.8 grams. There's a lot of research showing that going above that, particularly for older adults, really does help with preserving muscle mass. We also want to think about having adequate essential fatty acids through nuts and seeds, primarily to get alpha-linolenic acid, excuse me. We also want to think about a source of long-chain fatty acids. So these are your long-chain EPA, DHA found in fish, as well as purified fish or algae oil supplements. I find that the calorie density approach, which is an evidence-based approach to weight loss, is a very doable approach for most people, and it really focuses on shifting your plate to lower calorie density but nutrient dense foods. If we look at the amount of calories per pound of different food groups, by and large, what we see is that these whole plant foods are the lowest calorie density. So starting all the way at the top with leafy greens and cruciferous vegetables, non-starchy vegetables, fruits, starch and root vegetables, whole grains, and legumes. As we move down into higher calorie density foods, we start getting into animal protein and processed foods. So I recommend modifying those foods, particularly with animal protein. We want to think about overall health, and there's emerging research showing that shifting to include more and more plant protein provides a lot of health benefits in terms of cardiovascular disease, cancer risk, and overall mortality. Not surprising, we really want to work on limiting and reducing processed and junk foods that are very calorie dense and nutrient poor. Nuts and seeds here are very calorie dense, but they're still in the green here because we know that there are a lot of health benefits to regularly consuming nuts and seeds. But we want to be mindful of that, of how many nuts and seeds we're taking in per day. And as a general rule, I recommend thinking about maybe a quarter to a half cup per day. But sometimes we need to go even lower than that. Looking at the most calorie dense things are with butter and oils, right? So 1 tablespoon of oil is 120 calories. There are some health benefits to oils, particularly with extra virgin olive oil, but really when it comes in place of saturated fat. So just being mindful of how much oil you're using to cook, we may need to lower that in order to support that calorie deficit. Let's talk a little bit more about protein, which is such a hot topic, not just for body composition, but for overall health. The thermic effect of food, right, is the amount of calories you have to expend to digest and absorb the food. Protein has the highest thermic effect, more than carbohydrates and fat. And total daily energy expenditure increases in long-term higher protein diets, but this is driven mainly by an increase in resting energy expenditure through increasing your lean body mass. So again, the protein goal here I'm recommending is to get above that 0.8 grams per kilogram here, more like 1.2 to 1.6 grams per kilogram of your ideal body weight. And there are tools online to calculate what your ideal body weight may be based on your height. Plant protein is very comparable actually to animal protein in terms of helping to build muscle mass and strength when the grams for protein are equated there. So they've done some very interesting studies here. And despite what you might read online, that plant proteins are incomplete proteins, it's really not true. Plant proteins do contain all the essential amino acids. They may have relatively lower amounts of the essential amino acids, and they often have a little bit less amount of one amino acid called leucine, which is the main amino acid that is triggering muscle protein synthesis. But as long as your total amount of protein, whether that's coming, exclusively or mostly from plant protein, does support muscle mass. I recommend trying to evenly distribute protein throughout the day, trying to get about the same amount of protein at each meal. So we know that protein intake supports fullness and lean body mass, but again, I don't want you to hyper focus on too much protein. There's no benefit really of going above that 1.6 gram per kilogram body weight for the average person. It really just adds calories. Physical activity plays a much bigger role in optimizing lean body mass. So if you're eating a lot of protein, you may be supporting your lean body mass, but you really need the resistance training to get the full benefits there. There's some important nutritional considerations with aging. For older individuals, they tend to eat less for a variety of reasons, and undernourishment is closely tied to sarcopenia and frailty. You know that calorie needs often decrease as you get older, but the absorption of nutrients becomes less efficient. So there are risks here of micronutrient deficiencies of different vitamins and minerals listed here. Often, older individuals are not consuming enough protein. They have suboptimal intakes, and they're also just less efficient at assimilating that protein. So again, trying to just push a little bit higher with protein intake can make a big difference here. Structuring your meals around lean protein can be helpful, as well as whole grains, vegetables, fruits, nuts, and seeds if you're able to adequately chew those. I also find that for my older patients who struggle with calories, that smoothies can be very helpful. But I recommend consuming them slowly over 20 to 30 minutes, similar to how you would have a regular meal. Intermittent fasting also has a lot of focus on it now, and this is essentially another tool for controlling calorie intake, and it's focusing more on when you eat. So there's three kind of main ways to do intermittent fasting, and time restricted eating is one where you're essentially narrowing your eating window and spending more time fasting overnight. There's alternate day fasting where you may do 24 hours of fasting off and on every other day, as well as whole day fasting, such as the 5 to 2, where you're doing 5 days of just regular eating and then followed by 2 days of fasting. And the weight loss here is pretty modest. We're looking at maybe 1 to 7.5 pounds of weight loss on average in the studies done over approximately a 6-month period. There may be a slight advantage from the alternate day fasting, but it doesn't necessarily mean that that is the ideal form of intermittent fasting for you. Combining intermittent fasting with light to moderate intensity exercise is more beneficial for body composition changes, favoring fat loss and lean mass preservation. Now, intermittent fasting may not be suitable for older individuals or for those with very complex medical conditions on many medications that may need to be adjusted during a fasting period. Those with eating disorders may not also benefit from doing forms of intermittent fasting. During periods of very high stress, fasting is a form of stress on the body. It also may not be during those times. I want to talk just briefly about managing stress. So we know that chronic stress negatively impacts body composition. So chronically elevated stress hormones like cortisol, as well as that low-grade chronic inflammation that I talked about earlier, have both direct and indirect effects on fat mass, fat gain, and lean mass loss. So with this hyperactivation of the stress pathway in the body, this directly activates adipose tissue, or the cells within the adipose tissue, and this leads to changes in overall eating behavior that tend to sustain the weight gain. Fat tends to then accumulate in muscle, reducing overall muscle mass and function. And these stress hormones also directly work on the bone, preventing bone remodeling, right? So we start to get this vicious cycle here with the chronically elevated stress hormones reinforcing the body composition changes of aging. Now, I want to refer you to an earlier Integrative Insider Live talk by Dr. Chris Gabriel, given in January, I think, where he goes into depth about the strategies to improve overall well-being and happiness. And I think you'll gain a lot of important tools from that you can apply here. I want to end here with looking at a few evidence-based supplements for body composition. So there's a lot of evidence for whey protein, not just for body composition changes, but even cardiovascular disease. And so whey or plant-based protein powder can be very helpful, especially for older individuals, if they need that to help them hit their daily protein targets. Creatine monohydrate as well is probably the most well-researched sports performance supplement and is very safe for most individuals. And the most common dose there is anywhere from 3 to 5 grams per day. It's the most studied for improving overall capacity with exercise and lean mass. We also look at fish and algae oil. So again, these are a source of those long-chain omega-3 fatty acids, and there's a wide range here for the doses that have been studied, anywhere from 1 gram all the way up to a high dose of 4.5 grams per day. Has been shown to reduce that disuse loss of muscle during periods of inactivity, as well as increasing muscle mass and strength when combined with resistance training. I do want to caution here, though, on high doses of fish oil can increase risk of atrial fibrillation in those who are predisposed to that. When we look at overall stress management here, I just want to mention that adaptogenic herbs like rhodiola, ashwagandha, certainly can support those stress pathways, and ashwagandha itself may have its own independent weight loss benefits, but I think more research needs to be done there. A few other supplements here that are very common in a lot of the sports supplements, including things like pre-workout powders. Beta-alanine is one example of that. This can really help with overall exercise capacity and performance. It tends to produce a tingling sensation, so at the higher dose, you're definitely going to feel that. But for most individuals, they can tolerate higher doses of that. Another option is L-citrulline, which helps to increase nitric oxide in the body, which helps with endothelial function, overall blood flow. So you see that very commonly in a lot of workout supplements. Another interesting finding from one trial was melatonin, actually. So a few milligrams of melatonin showed that in postmenopausal women, taking this consistently over the course of a year, did seem to support preservation of lean body mass. When you're looking at supplements, I recommend high quality supplements. So one way you can find that is to look for these labels of informed choice or informed sport. And there's rigorous testing that supplements go through, particularly the informed sport certified supplements, where they are essentially testing every batch before they even go to market. Let's look at 5 key take-home points here. So as you have learned here, that aging and body composition changes overall are inevitable, but there's a lot we can do to help prevent that, and particularly to avoid frailty. I recommend intentional and consistent resistance training across the lifespan, but again, any form of exercise is going to be beneficial here. In terms of nutrition, focusing on whole foods, high fiber dietary pattern with adequate protein. I also know that chronic stress is modifiable, which for some individuals, and probably most individuals, may be one of the first steps to getting on the right path here to pursuing your goals of optimizing your weight or your overall body composition. And lastly, it's always best to take a team approach here. So at Susan Samueli Integrative Health Institute, we have a large integrative health team here, including registered dietitians, health coaching, behavioral therapists, and you can look outside of in your own community for good personal trainers that you can work with. And I recommend finding certified personal trainers through the National Academy of Sports Medicine. And, and others may need physical therapists to work around certain injuries or certain areas of pain that may prevent them from fully engaging in exercise. So thank you all for listening here. And I think we'll transition here to if there's any questions that come in, I'm happy to answer those.
Well, thank you so much, Dr. Herring. I did a few squats while you were lecturing to get in my little bit of exercise. I had a question for you. If you have any recommendations on the timing of exercise,
Mhm,
or like, you know, general wisdom about exercising in the morning, afternoon, or evening.
mhm. Yeah, and I think that there has been some research looking into this. And in my opinion, I don't necessarily think the timing of exercise really matters. But where it does matter, I think, is if you're using certain supplements, for example, to improve your capacity to do exercise, certain pre-workouts that may contain caffeine. I would say that if you can shift your exercise to earlier in the day, that would be better to make sure it's not affecting sleep. I would say working out right before sleep. I mean, if you don't have any other choice, you know, that's fine. But we know that there's an increase in body temperature through exercise, and that may um, make it harder to wind down and get ready for bed. But generally speaking, I would say whenever you can do exercise, you should do it.
Thank you. I mean, um, I was looking at some of the research on exercise, and it was talking about how um, if you do kind of high intensity interval training or even moderately intense workouts, it can temporarily increase your cortisol levels.
Mhm.
And, you want your cortisol levels to decline so that you can go to sleep in the evening. So I guess it just kind of depends on the intensity cardiovascularly, maybe, of the workout.
Yeah, I think that's a very good point. So we know that when we look chronically at exercise as a form of stress, we do see benefits, and in fact, the stress hormone release with such as cortisol, for example, from exercise can benefit overall health actually. But as you point out, if you're doing very high intensity exercise right before bed, well, maybe not such a good idea. But keeping in mind that exercise is generally a good form of stress, even though it may be increasing some of the stress hormones, they work locally on the muscle and can actually improve overall metabolism.
Yeah. And then just improve your overall resilience.
Mhm.
Um, One of our guests has the question of what is your opinion on Ozempic for weight loss?
That's a very good question.
Very
Uh,
popular question.
yeah. And, there's no doubt that weight loss medications like Ozempic and these other GLP-1 hormone medications are very effective. And depending on which one you're using, the average weight loss is generally 15 to 20% or more. But keeping in mind, that's always in the context of this lifestyle foundation that we're talking about with modifying your nutrition, your protein intake, and engaging in exercise. But on average, there's no doubt that if we compare weight loss, the average percent of weight loss from just working on lifestyle, there's no doubt that the medication tends to lead to more weight loss as a percentage. But if you are going to be using these medications, you really want to utilize these lifestyle tools here.
Great. And then I have a lot of patients that have done many types of diets in the past, and they have challenges um, with maintaining their weight loss for whatever reason. And do you, is there any things that you see or try to help with in terms of lifestyle or testing for people who've struggled with weight loss and have done continuous kind of dieting.
Mhm, mhm. Yeah, so this is by far one of the most frustrating parts of the weight loss journey. And that earlier when I was talking about that adaptive thermogenesis, this is really one of the main mechanisms that is occurring. So as you're losing weight, the body has uh, this system in place that is fighting against that. And so we really want to think about, the overall rate of weight loss, um, and really tuning into first the nutrition to determine, is that person still in a calorie deficit to produce weight loss? Have they taken that as far as they could? Are they trying to stay as active as they can through that NEAT that I talked about earlier, try to move throughout the day? We know that there's a threshold effect with overall exercise that you get to a point where more exercise is not necessarily going to produce more weight loss. And as you mentioned, Dr. Heck, it could become a form of stress on the body. But um, there's a lot of things to look at here. We have to look at the psychological aspect here and the overall behavior change. Are there things going on in someone's life that is affecting their ability to stay engaged in some of these lifestyle changes? Sometimes we have to take a pause on that and focus on prioritizing overall emotional health first. So you might need to connect with a behavioral therapist. And if you struggle with overall eating behaviors, that can be very important to address as well. And there are trained therapists that can help with that. But I think overall, the research is looking a lot at that energy expenditure part of the weight loss. And if you can really keep up with movement throughout the day, you can fight against that excessive lowering of the energy expenditure that happens with weight loss so that it's not so drastic. And therefore, you have a more forgiving threshold with your calorie intake to try to produce more weight loss. But I don't think
Yeah,
any one
I,
particular path there.
I don't see that. I mean, partly because we live in the Western culture, that my patients that do this kind of yo-yo dieting, they're active, but they're not moving throughout the whole day. They might be, doing some different types of exercises a couple times a week. We have another question of what is the optimal protein intake for people who have reduced
Mhm.
renal function?
Yeah, that's a good question, and it would depend on how reduced your kidney function is.
Mhm.
There is research looking at once you get to stage 3 of chronic kidney disease, um, lowering your protein intake may actually help slow the progression of that. So perhaps going back down towards that zero point 0.8 grams, or for some people, even a little bit less. And I know that that could feel a little bit uncomfortable, but this is where doing the resistance training becomes even more important to stimulate the muscle, which is probably 90% of gaining muscle. 90% of that is probably the doing the resistance training, and the protein aspect is probably a lesser part of that. But I recommend working with a registered dietitian who specializes in chronic kidney disease. But I would say also think about shifting your protein intake to mostly plant protein. And that has to do with the types of amino acids that are coming in from the plant protein compared to animal protein seems to be more favorable for preserving kidney function.
Right, I think that's all the questions. All right, well, thank you everyone for joining us today in our Integrative Insider Live community lecture. Our next Integrative Insider Live is scheduled on August 6th with our newest staff physician, Dr. Andrew Lee. He will be presenting on picky eating in children and adolescents. More information will be sent through your Integrative Insider monthly emails and posted on our events pages on our website at sssihi.uci.edu. And again, we will be emailing you guys the link to the lecture and the recording, as well as the valuable survey that we hope you answered in order to help us improve our community offerings. All right, well, thank you again, and we'll see you all next time.